Hello everyone and welcome back to another Facebook Live with myself. My name's Sam. I'm the sport and exercise therapist here at Shepherd Sports Medicine, or the pain and performance experts, and I'm here because I'm here to help you guys understand, especially this month anyway in general, running and everything to do with running in performance, strength and conditioning, biomechanics. We are in the last week of the month, which means we're on the last topic. So if you've missed the other ones, you can always go back and have a look and watch the previous videos where we've looked at how to enhance running performance using biomechanical analysis. We looked at choosing footwear for optimal running. We looked at strength training, and we've looked at improving efficiency and preventing injuries. And today is more based on how to assess and treat running injuries. So some people may be more interested than others in this. But today we're basically going to look at the most common injuries we see in runners, and how we assess them, and ultimately how we treat them. And hopefully the information that we go through today will help some of you guys not only look after your bodies better and make yourself more robust, but maybe even help you with any niggles that you may have. However, a disclaimer, I would say that if you are struggling, please go see a professional, so that someone that can help you out, give you the right advice, and obviously assess you firsthand to see what is going on, and if that needs treatment. But moving on, so we're going to start with like the most common injuries that we see. All right. When I say most common injuries, it pretty much is mainly just for runners here. Okay. So one thing we see quite a lot of, but probably not as common as people may think, is IT band syndrome, iliotibial band syndrome. So pain in the IT band, which is just down the side of the leg. So originating all the way at the hip, coming down to the knee area. Okay, on the lateral side, so on the outside of the knee. We also see a lot, and this is actually really common, a lot of patellofemoral pain syndrome, so runner's knee, and this goes hand in hand with patellar tendinopathy, really. So this is basically just knee pain at the front of the knee. It's usually just at the bottom of the knee, just below it, where the patellar tendon is. But some people also get quadricep tendinopathies as well. So basically just pain in the tendon, and this is just caused from a load issue, just overloading. The tendon's getting inflamed, it's getting damaged, and that's what's causing the pain there. Okay, so that one's actually really common. We see that probably more than most. Obviously, you get the odd ankle sprain, okay, which happens all the time. That happens in football, cricket, all sorts. But also running, we see that in running. We get Achilles tendinopathy. So Achilles tendinopathy is the tendon in the back of the ankle that goes all the way up and attaches to basically your calf here. Okay, and again, that's just overload issue causing inflammation, and that causes you pain. We also see a lot of plantar fasciitis, but this doesn't necessarily mean, it can be from runners. People who are sedentary get this as well. It's quite a common thing we see here, but runners do get it. Again, just a load issue. So that is the fascia on the bottom of your foot. So foot pain on the bottom of the feet, okay? Obviously, hamstring strains every now and then. All right, we see hamstring strains a lot in football, very common in football, probably the most common actually injury in football, but we see them in running as well, especially sprinters. All right, we see a lot of it in sprinters. And that goes kind of hand in hand. Sometimes we see chronic hamstring tendinopathy, so the hamstring tendon as well becoming an issue. And again, you probably notice that a lot of these issues are inflammation caused by load. Okay, and that's really important because that is basically what's happening here. Is people are loading inefficiently, and they're causing these tendons to basically load, break down, and this response happens, and they get pain, and it's chronic because it usually lasts a long period of time. And to treat this, you actually need to look at what's going on and treat the cause of the problem. Why is it loading? Is something not working in the body? Is there an imbalance? Are they loading here? Is the technique correct? All right, all these things could point in that direction, but it'd be about assessing them and finding out what's going on. So that's in terms of running, that's where you're going to see most of your chronic issues is tendon issues, load issues, And you see this a lot with people who have, they might run all their life, and then all of a sudden they're training for a marathon or they're training for a big run that they've never done before, and they increase their mileage, in which case obviously the load increases, and then these structures that haven't been loaded efficiently anyway for a long period of time are now doubling the load. So they're going to cause a lot of problems, a lot of pain, a lot of issues there. Okay, so that's why it's really important that you make sure you're loading correctly, the body is loading efficiently, and you get the right treatment for tendons. As a rule of thumb, tendons, they love load, but they hate pain. And when I'm talking about load, I'm talking about nice, slow, strengthening work. As soon as you start increasing the speed, like running, jumping, explosive, and doing that for a long period of time, that's going to really break them tendons down, and they're not going to enjoy that. They're not going to be very happy. Okay, so in terms of assessing, it's really simple. We just assess where the load issue is, what's going on in the body, and how to fix that. Okay, so easy peasy really when it comes to looking at tendons. They can be a bit of a nightmare to treat overall. They might take a bit of time, but in terms of what's causing the issue, it can be quite easy to find. In terms of things like more acute injuries, so this is ankle sprains, obviously we can assess these going through ankle range of movement, looking at what's giving you pain, look at where the swelling is, maybe where the bruising is as well. Most common is going to be ACFL and CFL ruptures, so that's anterior tibiofibular ligament, calcaneofibular ligament as well. And these are the most common ones that sprain or possibly rupture. A lot of people rupture these by accident and they don't know about it. Very common, but again, if you do, it's not a problem. You can live without that tendon, the ligament, sorry. And what's important is even if you had that issue and got diagnosed at hospital, they won't really do anything for you anyway. It's a non-surgical approach. Okay, knee issues, hamstring issues, yep, easy to assess in clinic. As long as you get an expert to do that. But you're looking for signs of swelling and bruising. They're usually a big telltale factor that something structural has been damaged. It could be anything from just a muscle sprain to ligaments to cartilage. All right, there's lots of different things that can cause that response. But if that is happening, if you have that response of swelling and bruising, chances are you caused some sort of damage, and that damage will vary. Usually the more swelling, more bruising there is, the more damage there is. But again, if you're unsure, please speak to an expert, as they will probably be able to diagnose that and help you out. But most of the time, most things just, sprain, they tear a little bit, but, it's never really a full tear. If you have got full tear, then yeah, you'd probably know about it, if I'm honest. Yeah, you probably would know about it, apart from maybe the ankle. Okay, the ankle can be a bit iffy, hit and miss. So they're probably the most common injuries and how we would assess them. We see this time and time again. We see runners day in, day out. So it's something that we see a lot of and have become quite confident at actually assessing runners and assessing their injuries. And a lot of the time it's fairly straightforward and simple. You can assess them, get to the bottom of it, and then start treatment. Don't get me wrong though, maybe the odd one will be a bit more complicated, but we always end up getting to the finish and getting them sorted anyway. So if you are someone that is struggling with a running injury specifically, and maybe it's something that I've mentioned that you have or are suffering from, and it's just not going away, then definitely you need to speak to an expert or someone like us who can help you out and find the cause of the problem. Because remember, it's really important that we do find the cause. Otherwise, it may just come back again. So if we get rid of the cause, strengthen you up, get you nice and robust, then you'll be fine. And as I've already spoken in the previous weeks about strengthening, if you've watched the videos, you should know kind of how we would get you to be robust and how we would get you stronger once we've treated the problem and got you out of pain. All right, but in terms of injuries and assessing, that's it really. Without going into too much detail and being here for hours and hours, most of the time it's pretty straightforward. As long as you know what you're doing and know how to assess it, and you know your anatomy, then you can assess injuries quite comfortably. And in terms of treating them, again, it's just about finding the cause. Why is it loading so much? If it's an acute injury, you know what the cause is, and it's actually about managing the injury and getting you back to your strength and back to your best as soon as possible. But if it's a chronic injury, it's more going to be a load issue, and it's about managing the load and how can we actually improve your body and make it more efficient at handling that load as well. So I hope today has been insightful, and I hope you learned a few things about injuries, especially the most common injuries, how we would look at them and treat them. And yeah, like I said, it's really common that we see a lot of these. If you are suffering from something, then you could possibly leave me a comment, and I'll get back to you about it. Especially if you're unsure where to go next or what it is, maybe we can certainly help you out there. So I just want to say a big thank you all for all of you guys tuning in to watch me, and I hope you found this information. I hope you found this informative and helpful, and I look forward to seeing you all next month on our new topic. Again, if you have any questions, fire them in. Love to help you all out and answer your burning questions. So thank you so much, guys. Take care of yourself. Bye bye.